There are two different methods that can be used for aseptic catheterization. You may either keep one hand sterile and one non-sterile, or wear a new pair of gloves when handling the catheter. You should attempt a trial with each, and then decide which one you prefer. In this animation, we demonstrate catheterization using one sterile hand and one non-sterile hand. Gather the equipment needed and place the items on the lower shelf of a trolley, which has been cleaned with disinfectant towels. Standing at the patient's right-hand side, open a sterile towel and carefully place it on top of the trolley, avoiding touching the upper surface of the towel. Open the packs containing the other equipment and carefully drop the sterile contents onto the trolley. Put some saline into the sterile pot. Wearing the sterile gloves, ensure the syringe is filled with 10 milliliters of sterile water and the plastic wrapper is removed from the catheter before continuing. Carefully place the fenestrated paper towel over the penis and place the kidney dish on the towel below the penis. With the left hand, grasp the penis and withdraw the foreskin. With the right hand, take a swab soaked in saline and thoroughly clean around the glands, penis, corona and urethral meatus, and then discard the swab. With the right hand, take the cap off the lubricating gel and gently insert the tip of the syringe into the urethral meatus, then expel the contents into the urethra. Squeeze the penis firmly with the thumb and forefinger of the left hand to prevent the lubricating gel leaking out. If the lubricating gel contains local anesthetic, wait for 3 to 5 minutes for it to take effect. Insert the tip of the catheter into the urethra and guide it in with a steady, gentle pressure. Continue to pass the catheter into the bladder. Some resistance may be encountered in the prostatic urethra. Pointing the penis down towards the feet will assist passage of the catheter past this point, using a steady, gentle pressure from the right hand. When urine appears at the end of the catheter, advance for a further 4 or 5 centimeters, then inflate the balloon with 10 milliliters of sterile water via the side port. Attach the collection bag or urometer and gently pull on the catheter until resistance is felt when the balloon rests on the bladder neck. Replace the foreskin.